Hello, my name is Ash, a counselor in training. This is my Relatable study podcast for individuals who need help studying for their NCE, CPCE, and other related counseling exams. I'm going to go through many questions from multiple resources and make the answers relatable to both you and me. So get your listening ears on and let's get studying. A son serves as his mother's primary caregiver following her cancer diagnosis. He has a home of his own, but spends most of his day at his mother's home. He drives her to her home at 6 a.m. daily to make sure that she takes her medications. He sometimes skips work to bring her to her medical appointments. His evenings are spent researching treatments for stage 4 cancer. Which statement is correct about the client's relationship with his mother? A. They are in an enmeshed subsystem. B. They are in a disengaged subsystem. C. The son's maladaptive behavior is due to a lacking of loyalty and trust. D. The son's maladaptive behavior is due to miscommunication. The answer is A. They are in an enmeshed subsystem, which describes the client's relationship with his mother. In these enmeshed subsystems, family relationships can lack boundaries, are confused in roles and expectations, have a lack of emotional boundaries, and the parent-child boundaries are blurred and roles are mixed. I would recommend looking more into enmeshed subsystems and disengaged subsystems to better identify what they would look like in a variety of situations, not just from this question alone. What is a moderating variable? A moderating variable is a factor that influences the direction or strength of a relationship between two variables. It also affects the independent variable and the dependent variable with their association. For example, stress is the independent variable that affects depression, which is the dependent variable. The moderator is social support, and it crosses paths with stress that leads to depression. What is the primary concern in test selection? The primary concern in test selection is the client's needs and wants. With this consideration, the mental health care provider will make an informed decision about which tests and psychometric techniques to apply for this client. A provider should suggest testing if there's a need to gain further information, but it is not necessary or is required. A group therapist must make A. Fewer decisions than an individual therapist. B. The same number of decisions as an individual therapist. C. Modality changes for each group. D. More decisions than an individual therapist. The answer is D. A group therapist must make more decisions than an individual therapist. Most experts agree that it is more difficult to do productive groups than individual therapy, and thus group therapists must make more decisions than an individual therapist. When I was working in my internship, the groups I did, I had to make a lot of quick decisions within the group itself to help moderate and keep the group going. What is modern psychoanalysis? Modern psychoanalysis is a contemporary form of psychoanalysis that emphasizes the therapeutic relationship and the emotional communication. Modern psychoanalysis is a dyad that often requires two people to play the role, the patient and the therapist. The aim for modern psychoanalysis is to help cure patients from freeing themselves from destructive and maladaptive repetitions that dominate their behavior in life. That is all 5 questions for this episode. Thank you for listening. Keep calm and study on.